that has the lesion in the nose. I know that's pretty much all I know, and I know you thought it would be compelling, so we wanted to know from you if you can just share with us the story and what it's about, what it entails, and then just kind of brief us on that.
So this is a 12 years old girl. She's from Cayman Island, and she had previous history of skin cancer, squamous cell carcinoma on the nose that was treated, and this lesion is growing back. What is very, very, very rare for a kid to have a skin cancer. And she already had a skin cancer that was treated, and it's recurring now. So she came here with a huge, I would say 10 centimeter exophytic mass on her nose that is confirmed to be a squamous cell carcinoma.
Wow.
So we believe this patient has some underlying genetic predisposition, a disease called xeroderma pigmentosum. So she's being evaluated for the genetics people here as well. But what is very sensitive in this case is her age, and is on a very sensitive cosmetic areas, in the middle of her face. She had already this lesion removed, and she's gonna need to have a very big reconstruction of her nose, and that very early age. And we just diagnosed another skin cancer in her chest as well during the skin check. She had another basal cell on her chest. That's pretty much her history for now. She does have a lot of sun damage on her skin already, what is also very unusual for a kid. But because she probably have this underlying genetic disease, what is predisposed her to sun damage. So it's a specific disease that her DNA, the cells, doesn't have the ability to repair the damage from the UV light. And that predisposes her to have multiple and more invasive type of skin cancer, what she has already, a big one, more than one actually. Yeah, that's her history for now. We did a PET scan. She did a PET scan actually before she came here, and it was some positive area as well on the node. So it's probably not just a localized disease, but it's very sad.
I know that skin cancer is usually more typical on people with fair skin or white race, I guess, if that's the way you normally say. Does she have is she fair skinned, or do we know?
Skin cancer is more common in people with fair skin, light eye, light hair, like blue eyes. Absolutely, but can happen any phototype, any skin type, any part of the body.
Okay.
She doesn't have like fair skin. The phototype would be 4, so it classifies as 1, from 1 to 5, the type of skin. So 1 is like very fair skin, like red hair, blue eyes, and 5 is black skin. So in the middle is the range from very light, like head, hair, and light eyes, to black skin. And 1 is like burn easily, never tan, and then depends if you burn easily or if you tan easily, you classify from 1 to 5. She would be between 3 and 5 and 4, but she already have a lot of sun damage, and with chronic sun exposure, your skin changes the color, becomes more dark, and with a lot of freckles, what is the solar ventricle that she already has it. So she's not like a classic fair skin that has high risk for skin cancer. Wow. That's why the diagnosis of underlying genetic disease is so strong for her. She doesn't have the formal evaluation yet. She's seen a genetic, but for sure she has it.
May I, Papsy, ask a question?
Yes.
This is John.
Sure.
Thank you, doctor.
Hi.
Is this genetic predisposition also rare?
Yeah.
I mean, for anyone, for kids, but even more so for kids as well?
It's a genetic disease. This genetic disease is rare. The one that we think she has it.
Okay, is rare.
Period. But when you have this disease, you usually manifest very early in life.
Okay.
So you can see even babies with a lot of freckles on their skin when they have this genetic mutation. And it's a rare disease, but usually you diagnose early in life.
Does it have a formal name? I don't know if you mentioned it or not.
Xeroderma.
Xeroderma.
Sorry by my accent. Xeroderma pigmentosum.
No, I just didn't catch. I'm sorry, I just missed it. Okay.
I can't type, but sometimes my accent you don't understand very well.
Oh,
Xeroderma with XE.
Right.
RODERMA pigmentosum.
Gotcha. Got it.
And what was she diagnosed with again, doctor? Did we get that? You said it at the beginning.
It's squamous cell carcinoma on the nose, and also basal cells on the nose and on the chest.
So both on the, okay, wow.
But the more visually, I guess, maybe the more impacting one, or more maybe even traumatic for her, I think you mentioned, is the one on her nose, correct?
Absolutely, yeah. She doesn't even raise her head. She's like looking to the floor all the time because she doesn't want to show her face. So it's very, very, very sad, very heart-touching situation. But again, I didn't talk to her yet. She didn't give me the permission yet.
And this is always a tough question to ask in terms of what is her prognosis? What is her?
So usually the skin cancer on this specific disease tend to be more aggressive, more invasive. So the person with this disease would have to change completely their lifestyle. Doesn't go in the sun at all, never. Because one day of sun exposure can bring these mutations on her DNA, and her body will not be able to repair.
Wow.
On her case specifically, she's gonna need more image studies. She had something on positive areas on the node on the neck,
right.
But we did what you call FNA, fine needle aspiration, that showed there is no disease on the node. But more tests would need to be performed to see, because this changed the stage of the disease if the node is positive. Okay. So it was a very new case. We saw her last week. So she's still on the workup process for her final staging.
Okay, in terms of, so typically
But Papsi, just one question, because we are talking very in detail about her case, and we don't know if the family going to agree. So,
right. Okay.
Yeah, it's for our background too. We want to know. Yeah, going in what. If they do agree, then we know what we're dealing with here in terms of the specifics.
Right.
So yeah, we understand. It's going to be
No.
I think that they will be happy too, but yeah. We couldn't reach them yet. We tried this morning.
Hi, doctors. This is David. I'm actually part of the media relations team. If you don't mind me asking, my understanding is this is far from over, right? There's definitely more procedure she's going to need.
Let me close the door here. I can't hear you.
I'm sorry.
Okay. Hi.
I'm sorry. So what I was asking was, my understanding is, based on what I'm hearing, is that this is definitely not over yet, right? There's going to be more procedures needed.
Yeah.
And it's not just cosmetic, right? I'm assuming these are not just to treat the nose reconstruction. This is to treat the actual condition she has. So
yes,
it seems to me like this is still a work in progress. Yeah. So we were thinking for media purposes, possibly including this as in a Miami Herald is posting a special kids and teens section where they're going to select a few stories from Baptist. We had one of these as a consideration for a patient success story, but the more I can consult, we can have a separate call about this later and talk to a couple other people and get their thoughts. But my initial thoughts are this is obviously not this is not a done case. This is an ongoing situation, and there's a lot of sensitivity here because of her age and obviously some issues and concerns about how she's looking at this moment. So you definitely want to be sensitive to that. So I'm not so sure if this is media ready. I can get a couple more opinions on that, but those are just my initial thoughts.
Yeah, David, thank you for mentioning that. So that's exactly part of the reason why we wanted to get on the call, Dr. Bargiel, to better understand where the case was in terms of timeline or process. I think I agree with you, David. My initial gut feeling or gut reaction for now, and of course we'll sidebar with the team, but I think for now, we typically, Dr. Bragioli, like to wait to tell stories of patients who've already finished the process, if you will, and then we can call it like a success story, right?
Yeah, I agree. Yeah, I think that makes sense.
That's typically
her case is not finalized yet.
Yeah. So okay. I mean, that's good to know. I know that you had mentioned other that you thought that there might be other opportunities or things that maybe other patients who have finished their treatment and are grateful and are have had a successful outcome. If you have any of those, please feel free to share with us. I don't know if there's something you want to mention now or anything new happening in
No, absolutely. We have a lot of patients that finish this treatment and they're very happy and grateful. Not only with skin cancer, but also we treat here patients with complication of skin of chemotherapy and immunotherapy, and we really make them feel more comfortable and change their life. Absolutely, we have all those patients. I don't have more like example of kids because here you see more adults. So
that's
and
fine.
I know that now you're looking for a child case, but yeah, I can think I can look for more examples and see if the page is willing to share their history.
Okay.
Yeah, and maybe this one could be used later down the road because it has such a unique component. The age factor, the genetic factor could be interesting, like down the road when she's completed treatment. Maybe we could like get back together and see how we can make this more media ready.
Yeah, I agree.
Great.
Yeah, I agree. It's a fascinating story. A case.
Yeah.
We're so rare, but yeah, we're not ready yet. I don't think for working on it here. So.
Right. No, I agree with the team. So Dr. Bragioli, but maybe something that would be worth finding out anyway, even early on, is the just trying to gauge the interest of the family in whether or not they would be open to sharing the story down the line. But that's up to you. Gauge it if you feel like you want to ask now or see later. Typically, as you could imagine, once patients have finished treatment and things are successful and have good outcomes, typically they're grateful and then they're willing to share their story at that time. So we now have connected, so you have my information and you can certainly, keep me posted on that. But in the meantime, and that was just because we had that timely possible opportunity, like David mentioned, that was for this week. But typically, we usually do stories on adults because MCI is more focused on adult cancers. So by all means, don't feel like you need to look for another pediatric patient at all. We'd be interested in any great from the clinic in general, an adult.
You were breaking a little bit at the end.
Yeah. Did you? Oh no, I was just saying that. Just keep me posted on any adult.
Sure, yeah.
That you have, and like I just mentioned, the best time to reach out to me is once they've completed treatment.
The treatment, sure, yeah.
They're grateful. Those are the easy ones that, in the sense that they're easier for them to want to participate, right?
Yeah.
While I have you, if you don't mind, I wanted to ask you about, I found out, I don't know if it's still going on, that you are probably going to be part of a panel with Baptist Health Community Health event where you're going to be sharing tips on, you'll be sharing tips with the community on skin cancer prevention. Is that correct?
So we did one here for the melanoma month last month, and actually we had one planned for next week. But the way they organize, they think that the time would be so short to talk about water safety and sun safety tip that they separated. So I believe we're going to be in July.
Okay.
But the one for next week, they separated because it would be too short to talk about huge topics.
Do you have those tips like in a PowerPoint slide or handy that maybe you can share with me, and we can do like maybe some kind of a write-up or blog post that we can share on our blog? Or
sure.
Share with me?
Yes.
Yeah.
I do.
That would be great. Because if you have those written up, we can attribute them to you and get them posted on, or share them with the media, or share them on our blog. You know, it would be wonderful.
Sure.
And
Yes, I do.
Can I ask you a quick question about that topic,
Sure.
Doctor? Regarding, and I know that it's already, I see outside it's sunny and extremely hot, and it's the height of the day in terms of sun exposure right now, and the beaches are opening up, public pools are opening up again. I think what's the most important message you want to send to parents regarding their kids and sun exposure at this time when everything is opening up? If there's one specific message you want to send to parents, and that you see in your practice that they may ignore things or not, ignore sunblock on kids or something that are.
Yeah, I think that the important is to avoid the peak time from like noon, 2 p.m. That's very important because the incidence of UV light on that time it's pretty strong. Other very important tip, I have kids as well, so I know that sometimes to put sunscreen, it's a battle. It's hard. They don't wait the 20 minutes they should wait. So using the protection clothing, the long sleeve shirt helps a lot because that area is protected and you don't need to reapply sunscreen on that area. So protection clothing for kids, it's very useful. You still need to put sunscreen on the face, on the hands, or if you're not using pants. But the protection clothing are like a life-saving because you put the clothes, they go. Sometimes to put the sunscreen and make them wait, it's very tough. Right. So the protection clothing, avoid the peak time. Little kids, younger than 1 year old, shouldn't go to the sun at all.
Really? Okay. Yeah.
Their skin, the surface of the skin for the total size of the little baby, it's not the same proportion for adults. So the absorption of sunscreen much higher in babies. So they shouldn't go. This is the best recommendation. Go out on the sun. What else? And the type of sunscreen. They should look on the back if it's zinc oxide. The mineral sunscreen is the one recommended for kids. And nowadays for adults as well.
Okay. And when it comes to kids versus adults, when both apply sunscreen, are kids still more likely to get sunburn? Are kids generally more sensitive?
The skin for the kids, they're more like thin.
Right. So
for us, because the long history of sun exposure, is skin kind of like thicker, but kids usually is more sensitive, but everybody should protect yourself. Yeah.
Okay.
And again,
I look forward to the tips. You send it to Papsy, and then I'll take a look, and I'll get back to you with any questions if I have anything else on this topic.
Sure. So Papsy, she can share my emails with you guys. So if you have any questions.
No, it's a very important topic at this time of year. And
yes.
No, yeah.
Miami.
Yeah, it is.
If it's something you have already written up, Dr. Bargioli, you don't have to write anything new. Just forward to me whatever you have, and we'll make it look better.
I have 4 points. Yes. Yeah.
Okay.
That'll be great.
Okay.
That'll be great. Yeah.
I have my colleague Erin on the line who has a couple questions for you as well. If you don't mind, Erin, go ahead.
Hi, Dr. Bargioli. The one question that I had, you mentioned was water safety. So can you share some tips as it relates to being on the water, skin, cancer prevention tips?
For skin cancer prevention, yes. For the water safety, yes. I would defer for the swimmers, the little swimmers people. But it's pretty much what I just mentioned. Like the protection clothing helps a lot. The mineral sunscreen to avoid the peak time, like from 10 to 4 p.m.
And as far as reapplication, are there any tips you have, especially if the children are in the water?
Well, it's pretty much the same. The thing is, in the water, you have a double reach. You have from the sun, the UV, it's the direct sunlight plus the reflection on the water. So you are more predisposed for sunburns if you're in the water. So you really need to reapply the sunscreen every 40 or 80 minutes. So when you buy a sunscreen, you should see on front of the the label if it is water resistant or very resistant. Water resistant, that means that you are protected for 40 minutes. Very water resistant, you're protected for 80 minutes. So you need to reapply more often if you're in the water. That's your, I'm answering your question.
That was great. That was very helpful.
Yeah, there are another important thing about sunscreen. I'm here with Dr. Christine Haushalter, and it's something that she just remind me now. It's about the chemical sunscreen that nowadays the FDA doesn't approve the chemical sunscreen for multiple reasons. One, it's because some studies show that your skin absorbs that chemical sunscreen, and you can find in the bloodstream after days. And this is some studies show that you can have some hormonal imbalance. So nowadays it's mineral sunscreen because of that. The mineral sunscreen forms like a barrier in the skin that reflects back the UV light, and the chemical absorbs that light. But the other things, the chemical sunscreen, they cause damage to the environment and the coral reef and the ocean. So it's another reason to us to avoid to use it.
Wow. How do you know the difference between a chemical sunscreen and a mineral? Is it?
Yeah, that's a good question. So usually on the front of the sunscreen, you're going to say mineral or physical sunscreen. If it's mineral or physical sunscreen, it's the one that are recommended. But the name of the substance that you should look on the back is zinc oxide or titanium dioxide. That's the one is safe to use.
We actually did a blog article about that. Yeah, I think it was last year when the FDA clarified that. I think it was last year. But we've done that specific. So yeah, it's an important distinction. Yeah, we'll bring it up again.
Great. And as it relates to cancer, Dr. Bragioli, is that the chemical sunscreen is also harmful, I guess, to the person?
Yeah, that's the thing. There's some study that show that your skin can absorb that chemical product and can go to your bloodstream. So this can cause some hormonal imbalance. So these studies are very controversial, and actually they did in rats, not like in the real world. And the other thing is the amount of sunscreen that they studied was much higher than the amount that really put on our skin. So the studies are controversial, but it shows some data that you have this absorption that can cause some damage to your general health and also for the environment.
Great. Well, thank you. One last question. Oh, sorry. Go ahead, Erin.
Oh, sorry. You mentioned the amount. Do you still recommend a shot glass worth of sunscreen, that application method, or is there something different that you recommend?
Erin, I can't hear you very well, but in general,
I'm sorry.
It's a half teaspoon for the face and the arms, and the whole teaspoon for the trunk and the legs. Yeah, and it's very hard to put this amount. So that's another thing. Usually I recommend a very high sun protection factor, higher than 50, because the amount that you really, in the reality, we put on the screen is not the recommended. So the studies show that if you put a 30, FPS 30 on your skin, in reality, this is protecting as a 15 because you are not putting what is recommended. So usually I recommend to my patient to put 50 or higher, because if you don't put enough, it's going to be at least 25. You understand what I'm saying?
That's a great point.
I think we could create an infographic, John.
Yeah, there's tips. Absolutely. I mean, once the doctor sends the tips over, the sun protection tips he's going to send over.
Yeah, I kind of told you all the tips here.
I know. I mean, if you haven't written out,
yes.
It'd make for a great infographic because there's a lot of great points there that people don't realize.
Yeah, I love that.
And is that amount different for kids? Is the teaspoon for the face, is that just adults or is that for kids?
The
Is there
zinc
a difference?
oxide, the mineral, is the one that is always recommended for kids. You shouldn't use never chemical sunscreen on kids. Nowadays, for the last few years, the FDA reformulated the recommendations for sunscreen, and this is the what you should use in adults as well.
Yeah.
And there are some states like Hawaii and other states that's already abolished the chemical sunscreen because the damage to the environment.
Yeah, I think the Keys did, or was it Key West, or I mean, I think
Key West and Hawaii, yes,
yeah,
that's true.
I think I'm not sure about Miami Beach. Maybe I'm not sure if they were considering it. I don't know if they went ahead with it.
But it's going to be the future. Yeah.
Absolutely.
Great. Any other questions from the team related to sun protection, skin cancer?
Yeah, I'm actually listening to this. I actually think it might be a good idea if you guys agree to include this sunscreen tips and things like that for kids, especially kids who hate putting on sunscreen, as a pitch idea for the Herald Kids and Teen section. I think it could be relevant for the summer months. What do you guys think?
Absolutely. I was going to call you afterwards to tell you that.
Yeah, I think that's actually good. So we might not have the patient success story right now, but I think this is more than relevant. We can include it.
Yeah, I agree.
Absolutely. It's always helpful.
Great.
Especially here in
And
Florida.
we'll be going out to the national media with something similar.
Okay.
And the infographic is a great idea, especially if we can show kids and adults like a comparison, because sometimes you don't see that. And it's good also to show like maybe an infographic, the protective clothing that Doctor was speaking of, because that is a very good tip and tool for parents.
Yes. So, all right, that's awesome, team. I agree with David and Aaron. Dr. Bragioli, I know you're going to send me what you have already, but does what you have already in writing, does it include the ones you just mentioned now? Is that the ones you mentioned?
Yeah, it's included this, yes.
Okay, perfect. Okay, because as you just heard, we want to go ahead and pitch your expertise and your advice to the media, but also it would be great for us to create an infographic of the information you share with us. So it'll be very helpful to have.
American Academy of Dermatology website for kids.
And then
So the American Academy of Dermatology website, they have few. I can send to you because I have here some PowerPoints, like with some cartoons to give like some recommendation for kids that are very cool.
Okay, well, we would create it out of like Miami Cancer Institute, like Baptist Health. Like we would kind of, I know that a lot of this information exists, but we would brand the infographic from us.
Yeah, it's great one for us. Yeah, that'd be great.
Aaron, did you have another question, Dr. Bragioli?
Yeah, my last question is, what do you have any advice on how to treat a sunburn, especially a child, maybe who has a sunburn and you missed the spot? What is your best tip for treating a sunburn?
The first thing, don't avoid this. Try to not do it. This is the number one thing. Yeah. So, especially in kids, this could be an emergency because you lose water from this very inflamed skin and can cause like severe dehydration and can make the kids go to the emergency room because of that. But if the kids had a bad sunburn, they really need to see the doctor because they may need to have some topical prescription creams, but keep the kids very well hydrated, like liquid water. It's essential because you lose water from this vasodilated skin. Anything else that you recommend for kids with sunburn that is over the counter? Yeah, that's the thing. If it's a bad sunburn, he needs to see. That's the thing to recommend. Yeah, because if it's very severe, they may need like topical steroids cream. That they need to see a doctor for that. So ideally, you should avoid it.
Yeah, the aloe vera and stuff like that. I don't think works.
Yeah. Hello? There's anybody there?
Yes, we're here.
Yes, we're still here.
Okay.
We're just absorbing the great advice that you're giving us.
Okay.
Yeah.
You're thinking about
So
the
you
day
don't
that
recommend-
your kid had a sunburn. We always
You
have.
don't recommend like an aloe or anything like that? Is that just a myth?
Yeah, we are talking about this here. We don't, especially there are some products that can irritate it even more than skin. So the skin barrier is affected. So something that doesn't cause allergy or irritation, if your skin is damaged by a sunburn, can cause it. So a really bad sunburn should be seeing a doctor.
Great. David, Aaron, John, do you guys have any other questions regarding this topic?
Moisturize the skin. Moisturize the skin, I would say, with baby, like Mustela, some type of like very hypoallergenic moisturizers is very important. So if the skin has a sunburn, a lot of water, gentle soap, like baby soap, maximum is the maximum that you can do it. Nothing abrasive to the skin, and moisturize the skin. It's very helpful.
But aloe vera is supposed to be a natural moisturizer, no? No?
Yeah. I'm here with a wonderful dermatologist that takes care of kids. Yeah. So, but yeah, like baby moisturizers. Mustela is a brand that I like very much. Aveeno for kids, it's good as well. But again, if it's like a bad sunburn, needs to see a doctor.
Aaron, does that answer your question? Did you have something else?
No, that's great. Thank you very much.
Okay, wonderful. Anybody else have any questions for Dr. Bragioli?
No, I think that's it.
That was wonderful. I do have one last small question, or hopefully a short question, unrelated to the tips. Dr. Bragioli, I think at the meeting with Dr. Kalman, you mentioned, I don't know if it was you or Dr. Weibel, mentioned that there is something very unique about the Miami Cancer Institute clinic that no one else in the world has. I remember somebody saying that no one else in the world has blank, but I don't know what the blank is. Can you?
Yeah. So yeah, I remember that part. So what you have here is the Vectra machine. The Vectra machine is one of a lot of other total body mapping system. The unique part of the Vectra is the only one that do a 3D imaging of the body. And that is only, I would say, 13 or 15 machines in the whole world. Here in America, there are like 5 or 6 in MSK, and one here, and I believe Virginia just bought one. The other one has 2, and the other ones are in Australia, 2, and the rest in Europe. So it's only 13 machines in the world. So here at the Miami Cancer Institute, we have the Vectra, we have the confocal microscopy, and the OCT, the optical coherence tomography. Here and MSK, they are the only 2 places in America, in the United States, that has it. It's not only here. MSK has as well.
Okay, but that has what? The Vectra and the other machines?
And the other 2, the OCT and the confocal microscopy.
Okay, so that's what's unique, is that MCI and MSK have.
Yeah, and besides that, so the technology part, it's make us very, very like different from the other centers. And the other thing that for me is my favorite part, besides the technology, is the multidisciplinary skin clinic. So once a week, we have this clinic where the patient is seen by the oncologist, the surgeon, the radiation oncologist, and by dermatologist at the same time. So we get together, discuss the case before we see the patient. So the patient avoid multiple visits. The patient has the opportunity to discuss their like questions and with all the specialty together. And for us, dermatologists have the opportunity to have so easy access to this specialty. It's wonderful. And for the patient, I couldn't see a better way to treat selected case, like patients with severe skin cancer cases, than this.
Right, I'm sorry, you said, I didn't hear you very well. Did you say who's the multi-D group? Is dermatologist, oncologist, and who's the other specialty?
Surgery and radiation oncology.
Okay.
Plastic surgery as well.
Got it, okay. Wow, and then this team meets once a week to review cases?
Yes.
kind of like the tumor board, but this is specific.
We do have tumor board as well. You have the multidisciplinary skin clinic, you have the tumor board.
Okay. Is this not a common practice to have at skin clinics?
Well, no. I don't know if UM has an MSK for sure, but I don't know how they do it, you know. I mean,
Okay.
it's not every cancer center for sure.
Got it. Okay. Wonderful. I think we are almost up on time. So again, I want to honor your time. This was great. I think we have I think more importantly, we got to meet you, and I love that you're so open and